So prompt intervention in stroke is very important because the brain is very sensitive to lack of blood flow. And so from the moment the blood clot blocks the blood vessel, the brain cells start dying. And so we have a very limited amount of time before enough brain cells die where you have a permanent deficit from the stroke. And so because of that, the sooner we restore blood flow by removing the blood clot, the better the patient will do. There was a large trial that was completed in 2015, and what it showed was actually overwhelming benefit for if we performed a procedure where we physically removed a blood clot, people would get a lot better. And that really changed the way that we approach stroke. It went from a medical therapy through an IV to a surgical therapy by removing the blood clot and restoring the blood flow. Hospitals recognized that they need to have an infrastructure for providing this service. And so Parkview has acted very quickly in this, and we involve everybody who may interact with the patient or be involved in their care, starting with the EMS ambulance personnel who may be the first medical people to actually see the patient, all the way through the emergency department, the physicians, the nurses, to the imaging, the CAT scanner where we have specialized imaging that will help identify these patients who are candidates, and then to the neurointerventional procedure room where the procedure is performed, and then after that their post-procedural care. This team, it's several disciplines that are working together. We meet regularly, we review every single stroke patient, and we look at the times. How long did it take to get from point A to point B? How long did it take to get from the CAT scanner to the angiography room? How long did it take really to get that blood vessel opened up again? And we also look at the outcomes. How did the patients do? And with this information, we're constantly refining the process, making it better and better and better. And at this point, we have it down very well and we have excellent results. And as such, we have been designated Comprehensive Stroke Center by the accrediting body. Physically removing a blood clot, it's an invasive treatment, but it's not done through a surgery. It's actually done through just a needle stick in the groin. So we access an artery in the groin. Sometimes we can access the wrist or an artery in the arm. And through that, we can pass a small tube that we call a catheter. And we can pass this tube through the arteries in the body all the way up to the artery in the brain where the blood clot is blocking the blood flow. Then, using various devices, typically suction, we will remove that blood clot and pull it out, which immediately restores the blood flow to the brain. There are softwares now available that will help expedite the diagnosis of these blocked arteries. And it does that by quickly reviewing the CAT scans of stroke patients. It does that in real time, and it will inform our neurointerventional team immediately once one of these scans has been performed where a patient has a blocked artery. It also allows us to see the images quickly on our phones, and it's all coordinated in this software package. It'll reach out to the team and start the process of getting this patient taken care of. This is employed at all of our Parkview hospitals, and so anybody who has a stroke at any of the Parkview hospitals will, per our protocols, will immediately get scanned, and that will pop up on our phones and we'll be able to review it immediately. So that's usually actually how this process starts. A patient has a stroke, they go to one of the satellite hospitals in the community and they get this scan, we see the stroke. Then we actually call the emergency department and say, there's a patient here, they have a large vessel stroke, which is the type of stroke that's typically amenable to this type of procedure, and that really gets the ball rolling. We have a state-of-the-art infrastructure that will allow patients with large strokes to be treated in a way that can minimize their stroke and in some cases completely eliminate the stroke that they would have. We take it very seriously and we put all efforts forward to getting everything done to expedite that patient's care to having that blood vessel open as quickly as possible.